Hi, I'm Dr. Ramanjaneyulu, gastroenterologist and hepatologist. Today, I would like to tell a few words about blood vomitings. Blood vomiting of a blood is a medical emergency. It can be small, it can be large, and it can be associated with passing a blood in the motion or passing a black motion. It is a medical emergency. Anyone who has blood vomitings has to attend the emergency medical department immediately in the nearby hospital. And the first principle of the patient is that one has to quantify the blood which is lost, and also stabilization of the patients by giving the fluids and, if required, blood transfusions. This vomiting of a blood may be because of major two reasons. One is ulcer disease and other is varix because of a variceal bleeding because of a chronic liver disease, that is cirrhosis of a liver. So once we stabilize the patient, if required by giving blood transfusions, the endoscopy has to be done, and endoscopy is one of the advancements in the management of these cases of blood vomitings. By this endoscopy assessment, we not only diagnose what exactly the reason for the blood vomiting, either it is an ulcer disease or varix, and after diagnosis, depending on this thing, endoscopically treatment can be given, which saves the life of a patient. If it is an ulcer bleed, definitely endoscopically we can give a treatment sort of a coagulation or a clipping or a banding if required for a variceal bleeding. With this, the most often, more than 99% of the times, the bleeding stops. After that, naturally we have to further evaluate the patient and observe for any recurrent bleeds. And once there is no recurrent bleeding and patient gets stabilized, he can be discharged. But with a variceal bleeding, one has to be on a follow-up, because till eradication of varices are done, he may require the band ligations, which is routinely done with intervals of 3 to 4 weeks. Once the varices are eradicated, the risk of rebleeding is almost nil. But in spite of that, those individuals with a variceal bleeding has to have a follow-up with the regular intervals. Whereas if it is an ulcer disease, once they take the treatment with the anti-ulcer agents, and once the ulcer heals, the risk of rebleeding is almost zero.